Welcome back to MSNBC Live. Now, as the nation mourns the death of Senator Ted Kennedy, questions remain about what impact his passing may actually have on the efforts to fix health care. Joining me now is Emmy and Golden Globe nominated actress, best-selling author, healthcare advocate, Fran Drescher. Now, she's a cancer survivor and launched Cancer Schmancer Foundation and the Cancer Schmancer movement. Did I get it right? Did I say Schmancer the right way? Did I?
Excellent.
You know, no Queen's accent, but, you know, a little Miami something. So tell me, because, you know, it's not only your own personal story, but you've taken it to Capitol Hill, yes?
Yes, oh, absolutely. I was very instrumental in getting the Gynecologic Cancer Education and Awareness Act passed by unanimous consent, the first of its kind in U.S. history. I've written up twice about in the congressional record for my lobbying efforts, and now in 2010 I plan to go again to Washington and start a new initiative for young people's his and her reproductive organ cancer research and prevention act, because reproductive organ cancer is on the rise in young people, and I find it extremely alarming, and I think that we need to arrest the situation ASAP.
And well, you said part of your personal story was maybe missing some signals about uterine cancer.
It took me 2 years and 8 doctors to get a proper diagnosis, and I had classic uterine cancer symptoms, but I fell through the cracks every step of the way, because I think that, and my story is not unique, most doctors are bludgeoned by health insurance companies to go the least expensive route of diagnostic testing. And unfortunately, many cancers at their earliest whisper point, when it's most curable,
right,
mimic far more benign illnesses. And doctors tend to subscribe to the philosophy, if you hear hooves galloping, don't look for zebra, it's probably a horse. But unfortunately, I was a zebra, and I slipped through the cracks every step of the way, being told by 8 different doctors that I was perimenopausal. And for women that have ovarian cancer, it's even worse, because they get misdiagnosed for irritable bowel syndrome, but that is a much more aggressive cancer than I have, and they absolutely could not wait 2 years. I was very, very lucky that I was functioning not as a patient, but as a medical consumer, and I didn't feel like the treatment that I was being offered was helping me. This is why I think that it's so important that we must have a national health care system of some sort put into place as soon as possible, and I fully support our president on that front. And I think that, you know, in the same way, we cannot have health care just be dependent on publicly owned companies that are beholden to shareholders and not really the consumer.
Oh, so you're speaking out strongly for a public option, in effect.
Absolutely, and it's not going to make you know, private health care go away at all. But I liken it to the similarity between, you have an option of using the privately owned UPS or FedEx, but there is the U.S. mail as well. And I think that one keeps the other one in check.
Unfortunately, we have to go, so a 10-second answer. Are you running for office? Some people have talked about you running for office next year. Are you running?
Not next year. I don't believe next year, but someday on the horizon, absolutely.
Queen's finest, coming to you soon.